Hi guys, my name is DR.LEE Sung. Welcome to my YouTube channel. Have you ever noticed that many men, especially after a certain age, start facing a very silent kind of problem? A problem they don't openly talk about, not with family, not even with friends, and sometimes they don't even fully understand it themselves. At first it feels small, manageable, almost normal. Waking up at night again and again to urinate, a weak urine flow, a feeling that the bladder is not completely empty, or a delay and difficulty in starting urination. Slowly, these small signs start becoming part of daily life, and life quality begins to change without even realizing it. Today, we are going to understand this condition in a very simple, clear, and practical way. This condition is called prostate gland enlargement, or medically known as BPH, benign prostatic hyperplasia. And the important thing to understand here is benign means it is not cancer, but it can still significantly affect daily comfort and lifestyle if ignored. The prostate is a small gland in the male body located just below the bladder and surrounding the urethra, the tube through which urine passes out of the body. Its natural function is related to reproductive health, especially contributing to seminal fluid. As men age, this gland can gradually increase in size, slowly, over years, and this gradual enlargement is what leads to pressure on the urethra. When that pressure starts increasing, the urine flow becomes weaker. The bladder has to work harder, and the feeling of incomplete emptying begins. This is why many men start noticing changes like frequent urination, especially at night, reduced flow strength, and a sense of urgency even when the bladder is not fully full. One of the most important reasons this condition often goes unnoticed in the beginning is because it does not cause pain in the early stages. It develops silently, slowly, without strong warning signals at first. And because of this silent nature, many people assume it is just normal aging, temporary weakness, or a minor issue related to hydration or stress. But over time, if the enlargement continues, the bladder and urinary systems start adapting to this pressure. And that is when symptoms become more noticeable and persistent. There is no single reason behind this condition. It is usually a combination of factors. Age plays a major role because hormonal changes naturally occur as the body gets older, especially changes in testosterone and other related hormones. Lifestyle also plays a big role. Long sitting hours, low physical activity, poor diet, and stress can all contribute indirectly to worsening urinary symptoms. When the body becomes less active, blood circulation slows down, metabolism becomes less efficient, and overall organ function can feel less balanced. Diet is another important factor. A diet high in processed food, unhealthy fats, and low fiber intake can increase inflammation in the body, which may indirectly affect prostate health as well. On the other hand, a balanced diet, proper hydration, and more natural food choices can support better overall function and reduce discomfort over time. Sleep and stress also cannot be ignored. Frequent nighttime urination can disturb sleep, and poor sleep further increases fatigue and stress levels, creating a cycle that affects both physical and mental well-being. It is also important to understand that prostate enlargement is not life-threatening in most cases, but it can significantly reduce quality of life if not managed properly. Daily comfort, sleep quality, confidence, and mental peace can all be affected if symptoms are ignored for too long. This is why awareness is very important, because early understanding leads to better management. The good news is that there are ways to manage this condition and improve quality of life. Regular health checkups help in monitoring changes early. A more active lifestyle supports better circulation and overall health. Proper hydration balance helps the urinary system function more smoothly. Reducing long sitting hours and adding light physical activity can make a noticeable difference over time. And most importantly, not ignoring early symptoms is key. Because when the body starts giving signals, it is always better to listen early instead of waiting for the problem to become stronger. If we simplify everything, prostate gland enlargement is a slow, age-related process that affects urinary flow due to pressure on the urinary channel. It is not something that happens suddenly, and it is not something that should create panic, but it is also not something that should be ignored completely. Small lifestyle adjustments, awareness, and timely attention can significantly improve comfort and daily life experience. And the most important understanding here is simple. The body always communicates through signals, and the earlier those signals are understood, the easier it becomes to manage them.